All right. Well, good morning, everyone. I'm Jenny Ravel, a global health reporter for Devex. Thank you for joining us today for this panel, where we'll have experts who'll be sharing insights on the current hepatitis B and C landscape globally, but also the situation in the Asia Pacific region, specifically in low and middle income countries, where a lot of you may be coming from. We'll have how it works, we'll have about 35 minutes for this panel, and then we'll go to a 15-minute Q&A session. So hold on those questions toward the end of this panel. All right, so let me start with introducing our esteemed panelists for this morning. We have with us Dr. John Ward, whom you've already heard from yesterday. He's the director of the Coalition for Global Hepatitis Elimination for the Task Force for Global Health. He has led efforts to strengthen national programs in over 190 countries through funding, advocacy, technical assistance, operation research, and disease monitoring. And he was the director of the US CDC's Division of Viral Hepatitis for over 13 years. We also have Roberta Sarno, is the director of the Asia Pacific or APAC Liver Disease Alliance and founder and director at T-Health Consulting. She has 14 years of experience in the healthcare sector across Asia Pacific, Europe, and the US, and has played pivotal roles in shaping health education and policies in the Asia Pacific region. And last but not least, we have Dr. Saeed Hamid. He's a professor and chair of the Department of Medicine at the Aga Khan University and Hospital in Karachi, Pakistan. He is also the director of the Clinical Trials Unit, and at present, he is on the advisory committee on the Hepatitis Fund and formerly was president of the Pakistan Society for the Study of Liver Diseases and the South Asian Association for Study of Liver. To our panelists, welcome.
Thank you.
Thank you. So before we start, maybe I'll just give up some numbers that may be of interest to our journalists today. As of 2022, we have 304 million persons living with chronic hepatitis B or C virus infection. Of the 254 million persons living with hepatitis B, 86% were unaware of their infection, and 97% had not been treated. And of the 50 million persons living with hepatitis C, 63% were unaware of their infection, and 80% had not been treated. Now, when we talk about deaths, in the Asia Pacific region, hepatitis deaths have reached 1 million per year, a death rate 3 times higher than deaths from HIV/AIDS and accounting for 63% of the global hepatitis death toll. Now, the World Health Assembly in 2016, the World Health Assembly is the ultimate decision-making body of the World Health Organization, unanimously adopted the resolution that viral hepatitis should be eliminated by 2030. In the same year, WHO also published a global health sector strategy, and you can all look this up online, so we don't go on tackling all of this. But since then, hepatitis testing and treatment have been made more accessible. Yet, as you've heard several times, in many places, particularly in low and middle income countries, there's still a lot of ways to go in reaching the elimination goal. So today, we're going a deep dive into hepatitis B and C. And our panelists will be talking about the burden of the disease, patient experience, barriers to testing and treatment, policies, and the future of hepatitis management. So let me start with John. Maybe help set the stage for us there. Contextualize for us the situation of hepatitis globally. Why is hepatitis still such a huge problem?
Hepatitis is a huge problem, and your numbers, illustrate that. We have 300 million persons living with this chronic viral infection, and you have over 1 million deaths a year that have surpassed HIV, a global problem that people think is larger than any other, but in actual fact, it's hepatitis has surpassed HIV as a global health threat, and a large part of that, under lack of awareness, is just how hepatitis acts in the body, or these hepatitis viruses act in the body. Hepatitis is often referred to as a a silent dragon in that the virus is, people become infected. They oftentimes have few symptoms when they become infected. And then the virus sets up shop in the liver and silently begins to inflame the liver. The liver gradually becomes scarred. The liver is a very stoic organ, doesn't cause many symptoms. So you live for years unknowing that you have this chronic viral infection that's slowly destroying your liver until at the very end stage where you do become symptomatic. And then oftentimes those infected people will develop liver cancer. Liver cancer has a poor survival rate around the world. And in fact, when you put hepatitis B and hepatitis C together, about 80% of all liver cancer around the world are caused by these two infections. And liver cancer is the third leading cause of cancer deaths in the world. So it's a huge problem. What I think is it's a current tragedy and a current opportunity is that almost all of these infections are fully preventable. And if we can get people tested early enough and into treatment early enough, a great majority of these deaths are fully preventable as well. And so that's our opportunity. And I really appreciate your attention to this because we really need to spread the word about this health threat, as you'll be hearing more from Roberta, particularly in this part of the world where the prevalence is so high.
You mentioned it. This is fully preventable. Can you talk about the situation when it comes to testing and treatment? What are the barriers and challenges there?
Well, as you mentioned, and then I'll just mention with the silent dragon, you have to get tested to know your status. Your symptoms don't tell you to go to a clinician and get tested. So, number one, we work really hard to raise awareness about this health threat so that we can begin to capture the attention of national governments. And then my coalition, and you'll be hearing from Dr. Hamid in a moment, then we work with national ministries of health to help them look at their public health data, to understand the burden, how large of a problem it is in the country, and where in the country it's highest, and then see how you can begin to direct the testing and linkage to treatment resources that can really turn the tide in decreasing this mortality rate and making the elimination of hepatitis B and hepatitis C a reality. Now, what can make testing better is the national governments having policies that instruct clinicians who to test. In many countries, there are recommendations to test everyone because the prevalence is so high. And it's best to know your status than to not to know it. If you're not infected, that's great news. If you are infected, you need to be getting treatment as soon as possible. And that's really the major message today, is that it's good to know your status. And then we have to, then you turn to getting clinicians and community-based organizations trained to provide the testing, and then have that linked to sites for treatment. Laboratories obviously play a big role in testing, but there are what's called point-of-care tests as also that can be done right by the clinician when they're seeing the patient, opening possibilities for someone getting diagnosed and getting started on treatment, at the same visit. And there's great promise for even having home test options, as we're all have become familiar with during the COVID response.
I'm going to go back to you on those point of care tests as well. Roberta, can you maybe let's deep dive on Asia Pacific? What's the situation here? Are populations needing these tests, getting those tests, and the treatments they need, or what are the challenges there?
Yeah, I think thanks for the question. I think from the numbers, you can already guess that the situation is not optimal in the Asia Pacific region. I think, probably the first reason is that most of the countries across the APAC region are currently lacking of an optimal national action plan, right? So the national action plan is either not there, or it's incomplete, or it's not adequate. And when a national action plan for eliminating viral hepatitis is not there, it means that at the national level, the efforts are not coordinated. And if the efforts are not coordinated, then patients are not prevented, so they are not vaccinated as they should for hepatitis B infection. As they are not tested, they are not treated. Okay, so that's the overarching issue. And you can see it very clearly. You mentioned the WHO objective, right? So WHO is telling us that by 2030, we should be able to eliminate viral hepatitis worldwide. And now if you look where the countries stand in Asia-Pac, you will see that most of them are not on track to eliminate viral hepatitis for a number of reasons, but definitely one common factor is that the national action plan is not there.
Maybe I'll lead on that, because why don't we have national action plans here in the region?
Yeah, and I want to explain that a little bit more, right? So the national action plan is one thing, and especially in low and middle income countries, it's complicated. And when I speak with experts, right, clinical expert and also policy expert, it's interesting their points of view, and many of them told me, we have made this very complicated. It's complex. It's not easy to understand at a national level what needs to be done, right? So there is a lot of lack of awareness and also lack of resources. The other problem is also the political commitment, right? So there are many other health issues that are taking the priority compared to hepatitis. And if you see some good examples from the region, right? Countries like Taiwan and Japan, they are on track to eliminate viral hepatitis. Why is that happening? Yes, the national action plan is there, very good, but the national plan per se is not sufficient. What we saw as good factors that are helping countries to eliminate hepatitis are strong political commitment. So the policymakers, the officials, the politicians are prioritizing hepatitis elimination in their country. Sustainable domestic funding. So you need to put money, right? You need to invest money. And there are a lot of issues for governments, especially across the low and middle income countries. The perception of the cost of hepatitis elimination is high, even though data are telling us a different story. So, of course, this is coming with a cost, right? But the cost of eliminating hepatitis is much, much lower than the cost of doing nothing. So we can elaborate a bit further that.
Right. Well, Dr. Saeed, I'm going to go back and get to you about, maybe give us some policy perspective. How can governments do, from a policy perspective, to progress toward elimination? We heard from Roberta, there's good progress in Taiwan and Japan, but of course, the Asia Pacific is such a huge region, and we do want to get more. How do we get more countries toward elimination?
So, thank you very much. Just some general comments, first of all. Roberta mentioned the deadline from WHO for 2030 elimination. And we often say that the battle for elimination is going to be won or lost in Asia Pacific, because of the fact that this is the largest continent or area, geographic area, both for hepatitis B and for hepatitis C. I come from Pakistan. Pakistan now has the dubious distinction of becoming the highest burden country for hepatitis C in the world. After Egypt, as you might all well know, after Egypt has dealt with its hepatitis C problem some years ago, we are now the largest country that face hepatitis C. And so are many NMIC countries in the region. Now, the issue here is that, as Roberta said, differ a little bit from Roberta, because the national plans are there. They're not implemented. That is the step that the governments need to take to really implement those national plans. And you've mentioned some of the barriers which particularly LMIC governments face. And those are the large number of sort of emergencies that they fix. For example, dengue, for example, malaria, for example, COVID. So the health focus gets so much divided that it does not get to the bottom of what is really important. As John mentioned, the death rate, we estimate that in Pakistan, one person dies every 20 minutes, or 3 people die every hour from hepatitis B or C. And these are all potentially preventable deaths. And that is what the sad part is about. And when we come to treatments, and I'm sure we've discussed those as well, the cost of treating a patient in hepatitis C, at least in Pakistan at the moment, is under $100. Under $100. There is no other medical intervention that we know of right now in these countries, which is so cost friendly or so cost effective. And Roberta mentioned that the long-term effects, the quality of life, the quality of just in life years go well beyond any accounting computation that you can make. So I think it's such a, for us at least, I'm sorry to say, such a no-brainer that governments don't get engaged in this effort as they should.
I want to build on that. So you mentioned under $100, how much that's cost effective in Pakistan, but what's going on in your country? Why and maybe is there something positive happening there that there's a way to kind of address this problem?
So just to give you some numbers, we have approximately screened now 30% of our population, and we've treated about 18 to 20% of the population. And this has happened over a number of years. This has not happened in a concerted manner. And this has happened with the collaboration of the private sector as well as the government. In fact, much of the treatment has happened in the private sector. People are able to pay out of their pocket because the treatment is so cheap, and therefore they're able to get it. What we are waiting for are those big government programs that now need to kick in. And we hope that they will, at least in Pakistan, they will kick in this year, and we will get those mass screening and treatment efforts, which will really be very instrumental in dealing with the big burden that we have.
You said hope, but maybe just to build on that, what will get you to that point? Or what's holding you to get to that point?
Political commitment, and political commitment. I think that is the bottom line.
Robert, I want to go to and just ask, what's the role of the diagnostics industry here? What role they're playing to address this?
So I think, for viral hepatitis and in general for every health issue, right? The way I see it is there is a role that the industry is playing on bringing health products on the market, right? So that's really the way we imagine the diagnostic industry. They're bringing us the tests, and these tests are allowing clinicians to screen, to diagnose, and also to monitor how patients are reacting to a given treatment, right? And to make sure there are no side effects. And, if John mentioned that hepatitis can lead to other diseases like cirrhosis, like hepatocellular carcinoma, and so on and so forth. So the diagnostic industry is bringing all these tools and technologies to enable us to manage patients, right? So that's one part, and it's probably the obvious thing. But then there is another component, which is less directly linked to the healthcare products, right? And it's what I see personally by working in the space is all the work that the industry is doing together with other stakeholders, right? So there is a lot of knowledge sharing, capability building, technical skills exchange, innovation that is done in collaboration between the industry and policymakers, academia. clinicians, patient groups, and so on. So this knowledge creation and knowledge sharing is really important because it also enables then the industry to go back to their products and improve them. Advocacy and generating and sharing knowledge for policy making, right? And if you go back to the action plans, then it's where you can see really the impact, right? So that's probably how I would summarize.
Dr. John, you mentioned earlier about point of care, and I'm really interested here because during COVID, there's been a lot of interest in how can we get tested faster at home. What's the situation for hepatitis?
Well, there are new technologies that have certainly hold great promise for expanding access to hepatitis testing, and there are good examples of that happening. There are point of care tests for hepatitis C. Let's start with that. And just quickly, you have to perform 2 tests to diagnose hepatitis C. Typically, you test once to see if someone has antibody indicating they've been exposed to the virus. But about a third or so people just with their own immune system will clear the virus, and the remaining people remain infected for life and at risk for liver cancer and these other conditions that we've been speaking of. And so you have to follow that up with what's called a virologic test.
I'm sure some of the journalists may be asking you if you can explain it in layman's term later on, but
okay. So one test, test for antibody, you've been exposed. Second test, see if the virus is there. That means you're infected and need treatment. There are options just to stick your finger and put it on a little card, and it'll tell you if you're antibody positive. And then you have a second test that can be done by your clinician on a machine that can look for the virus and in about 40 minutes or so give you a diagnosis essentially of current hepatitis C infection. So that worked very well, and the prime example of a successful national program is Egypt, which, as Dr. Saeed mentioned, as when they had the highest prevalence of hepatitis C in the world, they put in place a national program. They decreed that every adult would be tested for hepatitis C. And they put out a robust public health campaign. You saw my talk yesterday. I touched on this. Got over 50 million, 75 million people screened, 5 million diagnosed, 4.5 million treated. And they did that with this point of care. You have a finger stick for the antibody, and then virologic or virus detection tests to follow. In that particular case, they used a lab-based test, but that can be done at the point of care. Now, one of the big challenges that the point of care test for hepatitis hasn't been licensed in a number of different countries. So you lose out on that option for that point of care test where you really can have a test and treat opportunity. So I think one of the efforts we have underway is to see how we can get point of care testing more widely available. Now, at the same time, quickly, as Roberta mentioned, there are ways laboratories can also improve access to testing. There's different types of tests to look for the virus. They can do different techniques within the laboratory to make sure that this person is receiving a test to detect the virus, et cetera. So you need a variety of different options, frankly. And what we really need a great leap for, like we had for COVID, would be a home-based test. And it will be interesting. And I think it's, what Roberta was mentioning now, the diagnostic companies really are the ones that have to come up with these technical breakthroughs that improve access to testing. And a home-based test for hepatitis to detect the virus would certainly be one.
Well, Roberta, we've discussed policies, national action plans, we've discussed the role of the diagnostics industry. Can you talk about patients? What can be done to support patients? And maybe talk about stigma, because I think that's something that not a lot of people understand.
Yeah, no, thanks for asking this question. I think we've discussed a lot of barriers that are either political or related to the policy, and also technical, right? How to reach the patient, how to test them where they are, or treat them where they are. But there is another reason why patients are currently either not diagnosed or not treated as they should. And it's the social stigma associated with viral hepatitis, which is, due to the number of preconceptions about the disease. And if you look at some examples from the region, you will see why a patient with hepatitis is not happy about this disease and is probably also not complying to the treatment. So in the Philippines and in China, for example, if you want to apply for a job or sometimes also to schools, you can be rejected if you have a diagnosis of hepatitis. Okay, so I think this is a very clear and shocking example for me. And there are many studies, right, around how populations see these infections. But one recent one was showing that up to 60% of the Chinese and Vietnamese population think that a diagnosis of hepatitis would be a huge trouble for their families. So they are ashamed, right? And I think when you talk to them, then there are many, very interesting patient stories. And most of the issue is around the fact that people think that if you are infected with hepatitis, it's either because you are a drug user or because you are sexually promiscuous. And also there is a lot of irrational fear of contagion. And this is most of the times due to the fact that people do not know how the disease is transmitted. So a lot needs to be done to address this social stigma, so psychological support for patients and families, but also a lot of education, really to tell people what's the reality behind this disease.
What's being done in Pakistan when we talk about stigma?
So, if you allow me, just a couple of comments on the patient perspective. I think three things are important. One, there is still, despite of all the noise that we continue to make, there is still a significant amount of lack of awareness in patients about these diseases. That's number one. Number two, even if people know that there is such and such disease within their community, they feel so well, generally, at least at the start, that the immediate response is, why should I get tested? I don't have any problems. I am fully fit and fine. I work. I do everything. And so what is the problem? I don't need to get tested. That's often what we hear in the field when you go for these elimination campaigns and so on. So that is a big barrier. I think still, based on people that we have here, there is a lot of room for creating awareness indeed. Specific, not just to Pakistan, but to many countries in Asia Pacific, is the fact that a lot of our people go to the Middle East and other places for employment. And if they are surface hepatitis B surface antigen positive or hepatitis C antibody positive, even though they are fully fit and able to work, they are rejected. And this is a economic devastation for many of people in this region. I'm talking about Pakistan, India, Bangladesh, Philippines, many other places that these people travel. So I think and that is one of the major stigmatization that we face in this region. And we haven't addressed that. We haven't addressed that with the employing governments that these people are feeling fully fit and able to work in most employments. Fair enough that they may not be able to work in some employments, but they were able to work in many employments. So I think that is something that we need to focus on.
So raising on a lot of awareness and of course addressing that stigma to get people to do the work and be able to inform us. Now I do want to open this up for questions to our journalists. If you have any questions to our panelists, please raise your hand. Introduce yourself in your publication and which panelist do you want to ask your question to? Do we have any questions in the room? Yes, once.
Like Dr. Joanne saying you say that the patient will the patients of the hepatitis C they don't have any symptoms. So do you mean that everyone should get tested? I mean like me, like everybody in this room, because we don't know. It should be basic tests for everyone, for every people, right?
Which didn't.
I think you can. I think that's. I think for most countries in Asia, people should get tested for hepatitis. Absolutely, the prevalence is high enough, and the benefits are great enough but people should get tested in the Asian countries and know your status because now more than ever, something can be done for that person that's infected. And that's the big message that I hope all of you can take back to your countries, is that it's best to know your status. Ask your clinician, to get tested for hepatitis B or hepatitis C. And when it's offered to you, say yes. Because it's, like I say, if you're negative, that's good to know. That's great. If you're positive, there's drugs that can cure you, drugs that can treat your hepatitis and make you feel better immediately because your body responds to that virus being eliminated. Your risk of cancer in future years is reduced virtually to zero. So yes, in Asian countries, please send the message to get tested for hepatitis B, hepatitis C. Thank you.
Any other questions in the room? Yes, please, and congrats.
Anyone or Paul, you can answer this. Since you emphasize the fact that we lag behind the common goal of 2030. So what have to be done? What kind of urgent plan? And what is the cause that makes us leave behind in terms of awareness or testing or anything? But more importantly, what have to be done to catch up with the rest of those?
Dr. Saeed, you want to start?
So I can perhaps speak for the LMICs in Asia Pacific. I think the richer countries are doing very well. 13, 14 countries are on target to eliminate either well before 2030. So we leave them alone. But the LMICs, as I said, there are so many competing interests, health interests, that it is sometimes difficult for policymakers to focus on one thing or the other. Just to give you an example, Pakistan has the highest burden for hepatitis C, and yet Pakistan also has a very high burden for diabetes. 25 to 30% of our people are diabetics, and that may be true for many other countries in LMICs as well. So it is part of our job as experts, and part of hopefully your job as journalists, is to convince the governments that this is a worthwhile effort. It is worthwhile because we have all the tools available to do this. There is nothing lacking. We've got the testing, we've got the treatment, we've got very cheap treatments in many LMICs because of generic medications being available. We have simplified on the platform of WHO, we have simplified the screening and treatment guidelines to the extent that it could not be simpler. As Dr. Ward mentioned, just a finger stick test then a PCR for confirmation, and you're done, and you're on to your treatments, and that's the end of it. So I think, just to answer your question very briefly, it is those competing interests that sometimes this thing gets lost in the bigger picture.
Do you want to build on that, Roberta?
Yeah, sure. No, totally agree with the political commitment. I think it's number one. I think number two is also then going back to the implementation part. How can we allocate money and fund these programs, right? And I know it's difficult because sometimes people say, oh, this is working so well in countries like Japan and Taiwan. Oh, how can we replicate, in middle-income countries? But then the issue is the budgets are not the same. So I think there is also a lot of work to be done in terms of how can we support the governments to find alternative sources of funding, okay? It can be through, domestic funding with the funding from international funding agencies, for example, or through partnerships with the industry. So there are many different ideas. But one thing is clear is, it's really impressive when you read the cost comparison of a hepatitis elimination program versus doing nothing is crazy, right? The amount of money that is lost if the government doesn't do anything, and it's lost because then the government is assuming that it will need to treat the patient. It will need to, handle the premature death, the loss of future income. Okay, these are all the direct healthcare costs. And then the indirect, right? The loss of productive workforce, the burden of the family who has to care for the patients. So if you calculate, then you will realize, and there are a number of examples which are showing us that.
Any, maybe, yes, please. And there's other one as well. So we'll take two questions this time. Good morning, I'm Gina from Manila Philippines. So I just have a question maybe for Ms. Roberta. What emerging trends in infectious diseases do you think we should be paying attention to right now? I just want to ask in particular, for example, the role of AI or any learning machines. How does these developments in technology can help infectious disease management or even treatment in this, let's say, now and in the coming years? Thank you. And also we have another question. Right? Yeah. My just okay. All right.
Hello. I'm on behalf of Miss Zhou from Southern Metropolis State in China. I would ask Dr. John, as you mentioned before, that the prevention can be by vaccination, and how to detect this hepatitis is by diagnosis and testing. But as we know that in America and Europe, the percentage of patients is lower than APAC. So we would ask, is there any experience that in America and Europe can share with us how to limit the percentage of the patient like this, to know that there is the experience in America and Europe, and to know is there any discrimination in America and Europe in case that the patient is affected and they have positive. Do they confident to share with their relatives or their neighborhood about the illness?
Okay, thank you so much. Maybe Dr. John, you want to jump on that experience from America and Europe, and then Sarno on the emerging infect trends.
First, thank you for bringing up vaccination. Again, it's important for us all to remember that we do have a highly effective, safe hepatitis B vaccine that should be given to all newborns within the first day of life, and then with a 3-dose series completed as part of their infant immunization series. And the countries in Asia over the last 15 to almost 20 years now have done a spectacular job of increasing vaccination coverage among children. Why is that important? It's because the hepatitis B virus is spread at the time of birth from mother to child. And if the newborn becomes infected, they have a 90% risk of remaining infected for life and a 1 in 4 risk of dying prematurely from liver cancer or liver failure because of that chronic hepatitis B infection. So vaccination is very important. And China has done a remarkable job of lowering the prevalence of hepatitis B among children because of their vaccination program. Vaccination continues to be important. Where testing comes in is that pregnant women should be tested for hepatitis B that helps to ensure that their infant receives that hepatitis B vaccine, as well as some other interventions that can be done to assure that that infant is protected. And if the mother is found to be hepatitis B infected, they need to be referred for care themselves. And then that's where the testing of the whole population comes into play because people were born before the vaccine was available, and many people now prevalence is high among people in their 30s, 40s, 50s, 60s in Asian countries, and they're progressing toward liver cancer. You need to test them. I help them get the care and treatment they need so they don't die early from liver cancer. And siphoning back over to the U.S., I can't speak for all of Europe. It's a lot of countries. But in the United States, we have moved to a all-adult testing policy. So even though our prevalence is much, much lower than almost any Asian country, in the U.S., all adults are recommended to be tested for both hepatitis B and hepatitis C. We have general anti-discrimination policies to assure access to employment and to health care. When I was at the CDC, we worked with the Department of Justice to make sure that people who were entering health training programs like medical school or nursing school, if they were chronically infected with hepatitis B, they were not being excluded from that training. So the Department of Justice of the U.S. made a ruling to make sure that those people were not getting denied the training and that employment opportunity. So you always have to be on the lookout for those when discrimination occurs and then seek to overcome it. And then on a personal level, people have to people deal with their medical problems in a variety of different ways. But I think here I think the positive message, can help people deal with that stigma to let the public know that these diseases are preventable, number one, and then if people have them, they're treatable. And so they don't have the stigma of having a chronic infection that's going to shorten their life, that they can get the care and treatment that can help them lead productive, healthy lives that will help them, I believe, sustain.
And Roberta, on the emerging trends that we can use on the outset especially. Sure. No, thanks for the question. And I try to make it simple on this part. I think when we look at AI or in general, all the new digital health technologies, and you look at the journey of a patient with an infectious disease, then there are examples of impact of these technologies at every single step, from screening and diagnosis. And also, I think there was a talk yesterday on the use of AI for tuberculosis, if I'm not mistaken, from the Philippines. Very interesting example. So AI is definitely supporting with the diagnostics part, but also later on, right, treatment decision, and also particularly relevant for the APAC region is also the opportunity to better communicate between patients and clinicians, especially in rural and remote areas, because we saw that one of the barriers is really how can we reach the patients where they are. And these technologies are giving us the opportunity actually to overcome many of these barriers, right? And bringing closer the patient with their healthcare providers. I hope I answered the question.
Yes, a question. Please.
I'm Joe Latiano from SciDev. I have actually 3 questions. The first one is for John, and the second one can be anyone, but I would like to hear from Saeed, and then the third one again for everyone. Now, the first one you mentioned about the vaccine. Yeah, okay. Can you make a sort of a rundown so that everybody understands that from the media, which one already has a vaccine, depending on the type of hepatitis? And for those that hasn't had any vaccine yet, why is it so difficult to come up with the vaccine when that's actually the most obvious preventable treatment? And then the second one would be an honest opinion from you guys. And then especially I would like to hear from Saeed. Are we going to hit the 2030 target? And why Pakistan? Because I know Pakistan is very active right now in hepatitis campaign. And then the third one, which is kind of an experience related to me, because I've seen so many people in our area through my years, people, because we have here in the Philippines, we have this drinking habit and sharing bottles. And a lot of times, a lot of those people either have tuberculosis or hepatitis later on in their life. In fact, they die early. A lot of my friends there, families there. And local doctors would probably argue, oh, you gotta get in drinking sessions hepatitis. Some would say yes. Now, my worry, whether it's true or not, would be I've seen now teenagers sharing vaping gadgets. And I'm kind of worried whether would that also be, would cause an infection, a rise in infection among the younger generation, because the equipment itself is expensive, the chemical it's not. And so you will see, especially public school children between 13 to 17 years old, 16, 15, they're sharing just one gadget among themselves. And in fact, even the adults, it's kind of embarrassing. You have adults there sharing their gadgets with the kids. So I would like to be on those. Sorry, I'm too many questions.
Okay, so vaccines, honest response on whether we're going to hit the elimination target, and then, of course, the concerns of whether we're going to see a rise in infections because of the sharing of vaping and others.
Okay. Thanks for the questions about vaccines. So we have a vaccine for hepatitis B virus. We've had it for over 40 years now. It's been recommended for all infants to receive it immediately after birth for the last 30 years or so. And so, as I mentioned, countries have adopted that policy, particularly here in Asia, to a profound positive effect in greatly reducing the prevalence from over 10% in many countries down to less than 1% now. And it's truly, one of the great success stories, briefly, of hepatitis elimination. Of the UN, the United Nations, shares an elimination goal is that hepatitis B prevalence should be less than 1%, or 1 out of 100 children or less should have hepatitis B. That was their goal for 2020 among hundreds of these so-called Sustainable Development Goals. The world achieved that goal, and Asia was the leading region in that effort. And it was of all those hundreds of goals, it was the only goal achieved. And so that was a profound success story. And so what we're seeking to do is just make sure countries continue to have that high rates of coverage so that those prevalences will continue to fall. And the other good news about hepatitis B vaccine is that it looks like it really confers at least 35 years of protection for that person if they get it or get vaccinated as infants, and perhaps even longer. It's just that the studies haven't been conducted for longer than 35 years. The other virus, hepatitis C virus, does not have a vaccine, but just because of the nature of the virus. The virus changes its spots. It produces millions of small, millions of copies of the virus with very small changes in its structure, which confuses the immune system. So we haven't been able to develop a vaccine for that. As far as modes of transmission, quickly, if I may, just to say, these are so-called blood-borne viruses, which are spread, as the name implies, when you're exposed through a blood transfusion that hasn't been screened, or you get an injection that has a needle contaminated with blood from someone that has the infection. It can be spread in households when people share toothbrushes or shaving, or even incidental exposures to someone's broken skin. And so you do have those kinds of exposures, but you really don't get exposed through sharing eating utensils or smoking equipment and the like. It's unless someone really has a lot of blood in their mouth or something like that. So it really doesn't happen. And I do see in my own experience that one of the common misunderstandings of hepatitis B and hepatitis C is that it's some type of foodborne virus or exposures that you get during eating and sort of other kind of social gatherings. And it's really those are not the risk for hepatitis B and hepatitis C. And so the day-to-day social interactions don't result in hepatitis B and hepatitis C transmission.
Dr. Saeed,
Okay.
they want to answer a honest response to the patient.
Okay. So I will paraphrase this. At the current rate that countries are going, most countries in Asia Pacific will not meet the target of 2030 at the current rate. However, what do we need to do? We need to declare an emergency in all of these countries, the high burden countries, and health systems that are not well developed respond to emergencies. As we saw in COVID, for example, the Pakistan response to COVID was one of the most appreciated response, despite a poor healthcare system. And that was simply because from top to bottom, a emergency was declared and we responded. So if we can declare the hepatitis elimination as an emergency target, we can do it before 2030. I can assure you that. Thank you.
All right.
I hope that's an honest answer.
Do you have any more questions in the room? Okay, well, I have a follow-up question on the vaccine.
Okay.
To start that. Do we have a pipeline for hepatitis C vaccine at this stage? Are there developments being on?
Unfortunately, we really do not. The most recent trials, which ended several years ago, did not produce an effective candidate, and so there are no vaccine candidates currently under trial. There's continued value in producing one, and I know we do a fair amount of work for the U.S. National Institutes of Health, and there's interest in taking rethinking how to approach vaccine development. So, thinking about how to produce a vaccine is underway, but we don't have any effective candidates at the moment. I know we're closing. If you have any other follow-up questions, I don't know if you'll get my email, but I'm jward@taskforce.org, and happy to answer any other questions you may have. Blah, blah, blah.
All right. Well, thank you so much to our panelists, really, for an excellent discussion, and also for addressing the questions that we have in the room. That's the only time we have. But as Dr. John has mentioned, if you have any other questions, I'm sure they would be willing to address them off stage. Thank you again so much to the panelists, and thank you again for journalists for joining us. Thank you.
Everybody watch my car. They're right up here.
I'll know you guys.
Fair enough. Fair enough. I would like